Hi there, good morning. I'm Dr. Ahsen Nazir Ahmed. Today we are going to talk about the breast awareness program, and in this context, we are going to talk about the screening. Now, the screening concept is, as I said in another vlog, that breast self examination is important. Every woman, by the way, you remember I said in one of my talks, out of 8 women in the world, out of every 8 women in the world, one woman is going to have a breast cancer. So imagine the magnitude. It is so common. But the problem is, okay, fine, the treatment is available, it can be treated. The problem is that the patients present late, very late. They are not able to go to the doctor for reasons, there are many reasons. There can be social reasons, there can be cost, there can be other reasons like modesty, or going to not finding the proper doctor. So the concept of breast self-examination is that every month the lady does an examination of both breasts, standing in front of the mirror by herself, by her own hand. Now, how do you know what is the right way of doing a breast self-examination and what is the wrong way? Go to a breast surgeon, go to a doctor who has been trained for this. They have flyers, they have leaflets, they have videos. They will tell you what is the correct way of doing a breast self-examination. It is done in 3-4 minutes for both breasts. It is very important. If by breast self-examination a lady notices a swelling, or there is a painful area, or there is a discharge, that means the person has to go to a doctor. That doesn't necessarily mean that it's going to be a malignancy or a cancer. But the important thing is that there is something wrong, and this wrong must be corrected. The second concept of screening is called as mammography. It is a special kind of an X-ray of the breast, which is done by a special machine. It is not time consuming. It takes hardly 5 minutes to do the X-rays of both breasts. And there are 3-4 views taken, not just the anteroposterior view or the one view. It is 3 views, 4 views sometimes taken. And what information does it give? This is so important. There have been many international studies which have seen that before the breast cancer actually forms any of these 3 symptoms, or a lump or a swelling, the mammography is able to pick up breast cancer sitting there, sleeping in the breast, not active. There are many criteria for that, but I will just tell you one which is more common. It's called as microcalcification, specks of calcification. If you see a mammogram, like suppose we say that we decide an age, that from this age, every 3 years or every 1 year, this patient will undergo X-rays of the breast called as mammogram. And these X-rays will be done, and they will be read by the specialist doctors, by the radiologist, and then by the surgeon. They will discuss between themselves. And if they find that there is a suspicious area which has not yet presented or which is lying dormant, but it can become a volcano any time, then they will advise the patient by special means he can have a biopsy of that area. And if it turns out to be a malignancy detected on mammography, it's very, very, very early stage. It will not have a bearing on the life of the patient. The patient will have a good quantity and quality of life. The cost will be less. So by doing breast self-examination and by doing the screening program, now how do you get inducted into a screening program? Go to any of the breast surgeons and tell them that you want to have your breast screened. They will give you a schedule that this date, this month, this year, you must get these X-rays routinely as long as you live. Generally speaking, in the younger age, we tend to do the ultrasound or ultrasonic or sonological examination of the breast. But in little late age, after 40, sometimes after 35, we tend to do mammographies. But the screening is done at a little later age. So when these things are combined, both breast self-examination and the screening, they have a good yield. They have a good yield to tell us that something is right or something is wrong with the breast. So my request to all the ladies is, if you're listening to this, to all the people, to all the gentlemen, wherever you are in the world, if you're listening to this, you must go to a breast surgeon, ask them about breast self-examination, the technique, how to do it, and then you must also ask them about the screening. Do you need to have a mammogram? If yes, what is the schedule? When can you get it done? Where can you get it done? And by the way, it's not very costly, just like any other X-ray of the body. This breast awareness vlog is about breast screening. Early, I repeat, early detection of breast cancer. Breast self-examination, sometimes ultrasound of the breast, and mammography or X-ray of the breast. Have a nice day. Good luck. Thank you.